Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. Today's webinar is Clinical Success for Thromboangiitis Obliterans, Varicose Veins, Peripheral Artery Spasm with 40 plus years of herbal mastery with Dr. Jimmy Chang, sponsored by Evergreen Herbs. Dr. Chang has over 40 years of concentrated clinical experience, treating over 500,000 patients, specializing in differential diagnosis and herbal prescription. Today's sponsor, Evergreen Herbs, is the perfect partner for Dr. Chang, as he has strictly purchased herbs directly from them for the past 30 years. His pharmacy has over 150 single herbs and formulas combined. If you're interested in starting a pharmacy just like Dr. Chang, you can order Dr. Chang's Evergreen Herbs webinar special and receive 15% off on the herbs he currently uses in his clinic. This special includes formulas such as his famous astringent complex, herbal ABX, and various classic formulas and single herbs. I'll send a link in the chat room for you to check out. This class will be presented in a similar fashion as its previous classes, so I will explain Dr. Chang's webinar for our new students joining us today. Dr. Chang's formulas will be listed in the Fang Jia Fang style, meaning formula plus formula. In addition, he will write a percentage after a formula to indicate its ratio in the prescription. Dr. Chang typically prescribes his patients 100-gram bottles or 150-gram bottles if they are not local or if the disease is chronic. Dr. Jimmy Chang, a widely known figure in the TCM community, has been instructing at eLotus for the last 2 decades, contributing to a substantial array of courses on our platform. For those interested in more pulse diagnosis, we suggest also enrolling in Dr. Chang's comprehensive Pulsenergy 1, 2, and 3 course series for foundational pulse diagnosis knowledge. And for our new attendees joining us, allow me to familiarize you with our webinar room. Please set your chat from host and panelists to everyone so that everyone can be part of the conversation. To ask questions during the webinar, please use the Q&A box so that the questions remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available by the next business day late afternoon for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Dr. Jimmy Chang.
One more time. Hello, everybody. Chat, 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 chat. Okay, we're going. Yeah. Hi, everybody. This is Jimmy Chan. Sorry about delay of this class. I was out of the country and the internet was very slow there, so I sorry about the delay till today. Thanks very much to Sam that rescheduled this class today. Anyway, we're gonna talk about this funny. Hey, where's the thromboangiitis and obliterans and the varicose veins and peripheral artery spasm. This is very interesting objects today because it's kind of, it's not very rare. It happens every day, but I usually didn't understand the nature of those problems until I came up, until I found out that this term, thromboangiitis and obliterans is funny names, but anyway, it works. So let's talk about, I'm sorry, I did it again. Okay. But like I said, always in our treatment plans, we have to not just by the term. We do treatment not only by the terms, I do treatment by the patient's constitutional condition, how they look and how they build. And in other words, decide your treatment approach by their body type, not by the Western terms. Okay, we can make our plans by following their symptoms, but majorly we have to talk about decide by the body type. This is very, very important. So in other words, when the patient just sit in front of you or just walk into your house, your office, then you should have a understanding of what kind of a treatment you'll be planning for this patient. Big guy, small guy, all different. And their blood pressure and heartbeat rate can be a very important reference point. You make the pulse diagnosis and blood pressure. Pulse diagnosis may be a little bit not so easy for you, but blood pressure, you can read it carefully. And I always do that. When I was looking at the patient's file in front of me, I look at their blood pressure and heartbeat rate, and I got a general idea what I will do and what I will not do. For example, if the blood pressure is a little high, even the patient is weak, and the major complaint of this lady is, I'm so tired, please give me something to make me more energetic. But if the blood pressure was high and heartbeat rate is fast, I will not give her or him any Sichuan. That's a very, very important things you should put into your mind before you start doing any treatment plans, okay? And, okay. So in the beginning, let's talk about this. What's the difference between these two? Buerger disease and Buerger and peripheral artery spasm. The symptoms are quite alike, and the pulse is kind of alike too. So it's a little bit different to tell the difference. But for their classification, the Buerger disease, the thromboangiitis, is inflammation. Caused by what? I will talk about it later. But the peripheral artery spasm, or they call it spasmodic contraction, nothing to do, not too much with inflammation, just pure blockage. So the pulse, the jump, let's put it simple, the jump is kind of weak. And this, for the inflammation, the pulse, the force, let me say, the force of the pulse can be very strong. Well, that's it. Then this strong, but doesn't mean the peripheral artery spasm is weak. No, it's not weak. It just don't jump. The pulse don't jump. The amplitude is very limited. It doesn't jump, but it's there. But for any kind of inflammation, the pulse is jumpy. So it's not too difficult to tell the difference, right? All this is, in fact, peripheral blood, small vessels, but their etiology are different. So let's talk about it today so we can make proper treatment plan for any kind of these problems. Okay. Ooh. Buerger's disease, Thromboangiitis Obliterans. This is very interesting. I encountered this kind of problem from the patient when I was in Taiwan, but I didn't know. Again, I made a mistake. Yeah. Okay, whatever. I didn't know the term, but it really doesn't matter. I differentiate their problem by their pulse size and the body type and the symptoms. Buerger disease is a chronic progressive vasculitis. Well, litis means inflammation that primarily affects small and medium-sized arteries. Arteries, they cause pain, veins leading to intravascular thrombosis, which is obstructive blood flow. The inflammation caused the blood flow, and the dead blood also caused the blood obstructions of the blood flow. But the treatment will be totally different. But it's still in our range, well, our specialties, and may lead to tissues, ischemia, and necrosis. So the result is not so, I mean, the symptoms is not so important. It's the nature. This is the nature of the problem, vasculitis. We always focus on the nature of the problem, actually, not the English, the Western terms of the problem. That's how I've been doing my practice for the past 45 years. And the occurs heavy smoker. I didn't know that either. When I and it comes to several cases with the young people with the strange looks on their fingers. You can see the fingers. Usually you don't see the toes, but we can see the fingers easily. I didn't understand. I just saw that their fingers so blue. Even a young, strong guy. I never had any thoughts about this is smoking. I never asked him, do you smoke? I don't. But now I understand it's got something to do with the smoke. Okay, tell them to stop it. Anyway, small and medium-sized arteries. Tibial arteries, radial arteries, and might affect the hands and feet. Irreversible. That's what the Western doctors said. Not treatable. But we can, of course we can. With knowing this Buerger's disease or not, we still can treat the problem with the pulse and the symptoms, of course. So don't worry, we can fix it. Often accompanied by phlebitis. Phlebitis is inflammation, secondary inflammation, which is, come on, again, I made a mistake. Yeah. Okay. Maybe associated with Raynaud's disease phenomenon we talked about last seminar, right? And those simple phlebitis for the inflammation is secondary, and the blood clots, veins, and pain and swelling. The pulse should lie on the chi. The pulse have 3 levels, right? Light, medium, and deep. When you push the finger down, this is the skin. Lightly, you should feel a pulse, and another one in the middle, and the deep one in the deep position. So we're talking about here, and we should focus on the deep position. There are 2 different feelings you might feel on a deep position. It's very simple. It's weak or forceful. So if it's forceful, it's inflammation. It's weak, it's just weak. So that's very easy. When you touch the pulse, when you push the pulse down all the way, and when you reach the bottom, there's no place you can go, then you should feel if the pulse still jumping forcefully against your fingertips, or the pulse just simply disappeared. That's the weak and strong. And that can tell you the nature of the lower limbs. So when I feel the pulse is so weak in the bottom, I'll tell the patient, hey, your lower legs are so weak. The circulation is bad. Even this guy is a strong athlete, or guy went to the gym all the time, weightlifting, but still they can be weak on the lower part. And come on, I made it again. It can be hormonal too. Not only this inflammation, also the hormone can affect the circulation of the lower part. I focus on treating the problem with the hormone changes a lot lately. Okay. Smoking cessation is the only effective treatment. Of course, we should ask them to stop smoking, which is not very easy, but we still have a lot of treatment plans for any kind of this problem. Don't worry, we can do that. Amputation, oh, not so bad. Okay. But for the second part, actually the third part, peripheral artery spasm, spasmodic contraction or something. Peripheral artery spasm is a transient narrowing after due to excessive constriction. Haha, constriction is the condition we encounter every day, all the time. The pulse can be just so thin. It's easy. But the spasm of the artery can be anywhere. Blood vessel affecting the blood flow stream. Can happen on the heart, in the heart, on the artery, normal arteries like this, coronary artery. And if it's something like this might cause chest pain or even the cardio infraction or something like damage or ischemia or something. You can find the pulse. Remember my pulse within the pulse on the left foot. It's in my pulse book, pulseology book. This is a heart problem, a very critical heart disease. The heart blood vessel ischemia or infraction. It can be deadly. So you should learn to feel the pulse within the pulse from a book. Actually, it's something like this. The pulse. Now, this is the artery. Let's say this is the artery. So this artery, there's nothing but blood flow in there. What else? Actually, it's not. The so-called pulse within the pulse is that you can find a bundle of thin thread lines inside the artery. So it just totally just like this. I didn't know this, but when about 50 years ago, I invented, and I would say invented, I discovered this kind of feeling, this phenomenon. At that time, I didn't know this was something like this. I just know I feel this a bundle of small, thin red lines inside the artery. Actually, is something like this, constriction. So that's why I use 四逆汤 to open it up. And my opener, I will tell you later. And usually temporary, yeah. This. Yeah, it's temporary. So the pulse can be gone. But after your treatment or something, the pain will be better and reversible. We can open it up by using my opener. Oh, my opener is such a beautiful invention, huh? So this is difference between this the Buerger disease and the peripheral artery spasm. Spasm can be temporary, just spasmodic contraction, and that the Buerger problem can be permanent. Actually, it's reversible. Okay. Buerger 这个是中文的哈，就是一种慢性的进行性血管炎，它是一种发炎，所以它的脉会比较Sam, you need a new pen. OK， 发炎，所以影响到中小型的动脉，造成血栓、血管的堵塞，所以它的脉象会比较有力，因为是发炎，甚至会比较快一点哈，可以导，因为发炎就肿胀嘛，很简单嘛，就好像塞车一样，都堵在那里了，然后造成血流，导致血不通，就跟高速公路塞车一样嘛，那底下的路就不通，那下面的那些商店不都没有生意，都死掉了嘛，是不是？所以这种状况是发生在吸烟的人身上。不过我当年治疗这个病的时候，我也不知道它是跟这个抽烟有关系，只是我知道它的疾病的形态，还有它脉象，我就把它也治得好啊。主要是手脚小型动脉、经动脉、桡土动脉等等。西医说是不可逆，哎，我可以逆。当然，你如果长期不治溃疡，就坏疽，就末端就烂掉了，那不能怪这个医生啊，对不对？而且吸烟的人合并有糖尿病的话呢，更糟，是不是？这个末梢循环的堵塞更糟，再加上有钾低 I'm saying that the phlebitis can be combined with the diabetes and also the low metabolism rate, like hypothyroidism, can be together and causing this thrombophlebitis。治疗上，西医来讲会很严重，等搞到最后呢，当然就不能怪医生了，实际上你不早不治呢。那当然，吸烟是一个重要的戒止的因素，可是要戒烟谈何容易，是不是？反正如果这种现象，我都会叫他们多运动啊。